BurnMed, created by Johns Hopkins Hospital. Dr. Stephen Milner is a professor of plastic surgery, pediatrics, and dermatology, director of Johns Hopkins Burn Center and Michael D. Hendricks Burn Research Center, and surgical director of Johns Hopkins Wound Care Center in Baltimore, Maryland. In the 1970s, Milner graduated from the Dental and Medical School from the University of London, England, and then continued with his postdoctoral education into the early 1980s. He commissioned in the British Army as Surgeon Royal Army Medical Corps from 1984 to 1994, where he served as Lieutenant Colonel from 1991 to 1994. While serving in the Persian Gulf War, Milner was told to expect lots of burn victims for treatment. He understood that burn victims would need to have fluids replaced based on time of burns and their total body surface area. To decrease the delay in care, Milner devised calculations into two tables to expedite the plan of care when the patients arrive. Milner's idea turned into the BurnMed app to help the physicians better treat burn victims both in the hospital and in the field. The developer's goal was to provide a comprehensive 15-minute training on initial burn management using a mobile multimedia resource for lay practitioners. This was sparked after Milner went to Nairobi in 2009 after catastrophic fires claimed the lives of many. Although the clinicians were capable of treating the burn victims, they wanted to learn more about burn management. BurnMed uses a combination of video, photos, and text to provide a quick but thorough overview of how to handle burn patients. The BurnMed app allows users to rotate a 3D figure of a man, woman, or child to quickly calculate how much fluid to administer to a burn patient on arrival. The first step is to examine and locate the burns on the patient. The second step is to select the appropriate setting of man, woman, or child. The third step is to draw the burns onto the 3D figure exactly as you see them on the patient. Finally, the app will use the drawing to calculate the TBSA burn. The treatment guidelines will appear and provide steps to early management and additional links for further teaching. At this time, BurnMed is only available through Apple's iTunes. There are two versions called BurnMed Lite and BurnMed Pro. BurnMed Lite is a free app that only provides the diagram for calculating TBSA burn. BurnMed Pro provides the diagram and also includes the treatment guidelines for an additional cost of $4.99. Currently, BurnMed is only compatible with Apple's iOS system and devices. BurnMed Lite minimal capabilities are 3.8 megabytes and BurnMed Pro requires 112 megabytes. Both apps require iOS 4.1 or later and can only be used with iPhone, iPad, and iPod Touch devices. At this time, there is no documentation on the legal or ethical concerns with the BurnMed apps. BurnMed is a part of the Johns Hopkins Global mHealth Initiative to help train healthcare workers around the globe. Its benefits of easy access to up-to-date information, educating medical students, trainees, and physicians, and improvement of early assessment of severe burn injuries are features that drove this app to be a finalist for the 2012 iMedical Apps in Medicine 2.0 mHealth Award. The limitations with BurnMed it has no universal app and you must purchase Apple products. The app does not explain the calculations or the difference between the superficial versus partial and full thickness burns. I would recommend this app to someone who is interested in burns if they already own Apple products. I would also recommend that anyone that is interested in downloading this app become familiar with all stages of burns and not rely on this app for an explanation. BurnMed is a mobile app available only through Apple's iTunes at this time. This app was created to be used as a quick reference guide and help educate laypersons around the world to treat and manage severe burns within a 15-minute time frame. This app could be very useful in the nursing world if everyone owned an Apple product. The quick calculations would allow for fluids to be hung and treatment to start within minutes of the patient's arrival.